The Unified Protocols for Transdiagnostic Treatment of Emotional Disorders in Children and Adolescents are flexible, theoretically consistent, and evidence-based interventions for youth with a wide array of emotional disorder presentations. What do we mean by emotional disorders? Well, that could be things like anxiety disorders, it could be things like obsessive-compulsive disorders, depression, or any other concern where emotional distress is your primary target as a clinician. These treatments were developed in collaboration with Dr. David Barlow at Boston University and based on the Adult Unified Protocol that they developed at that site. We've been doing research on the Unified Protocols for Transdiagnostic Treatment of Emotional Disorders in Children and Adolescents, or let's just call them UPC and UPA, for over 10 years here at the University of Miami. Now, some of the content in the UPC and UPA may seem familiar to you, and in fact, it does incorporate effective cognitive behavioral strategies as well as acceptance and mindfulness strategies for youth. What's different about the UPC and UPA is that they're formatted to be applicable across a much wider array of emotional disorders. So a child who's presenting with both anxiety and depression concerns can be treated effectively within the context of the UPC and UPA. So what is included in the UPC and UPA? Well, the format's a little bit different between the two of them. The UPA is written as an individual protocol, meaning that it's for individual therapy with adolescent clients, whereas the UPC is written as a group therapy for children who are under the age of 13. However, both of these protocols can be utilized in individual or group formats, and it just requires a little bit of adaptation to do so as directed in our therapist guide. The content within the UPC and UPA includes motivational enhancement and goal setting. Then we work on things like emotion education and functional assessment of emotional behaviors. After that, we work on things like opposite actions for a wide variety of emotional states that may be causing problematic emotional behaviors, starting with sadness, perhaps using what might be thought of as a traditional behavioral activation paradigm, and then moving on to opposite actions for other emotions. Following that, we work on awareness of physical sensations, which includes some traditional awareness techniques, some psychoeducation, and then what we call interoceptive exposure to those kinds of somatic distress sensations. Following that, we have a relatively large cognitive component where we work on both cognitive reappraisal in a traditional sense, as well as problem solving in both interpersonal and other situations that may be causing distress for the youth. Following this, we have a more traditional awareness module, and within the awareness module, we have a number of elements, both present moment awareness and non-judgmental awareness kinds of techniques, as well as their application to increasingly emotional triggers or situations. Following this is what we might think of as a situational exposure component, but you can really use a whole variety of exposure techniques within this protocol, and there is really no limit into what you use here. You could use narrative exposure, exposure and response prevention, you could use traditional situational motion exposure, or even target things that aren't necessarily fear and anxiety within this module using other opposite action techniques. Treatment typically ends with some level of relapse prevention. It's important to remember that in addition to these child-directed components, the UPC and UPA also include an extensive amount of parent component as well. This differs a little bit between the UPC and the UPA. For example, in the UPC, we have an entire parent group content that goes along with the child group content. And when you look within the therapist guide and the child-directed workbook available from Oxford University Press, you'll see that these in fact have companion session materials throughout each of the 15 UPC sessions. Within the UPA, we have an optional parent module where you can delve into additional parent material as appropriate for your given adolescent client. What do you work on within the parent module? Well, there are things like emotional parenting behaviors that might be getting into the way for some parents of children with emotional distress. Now, because this can differ a lot, the type of emotional parenting behavior that you might work on, for example, overprotection versus criticism, might differ between the parent that you're working with. Some parents need more help with basic rule following and other kinds of behavioral strategies, whereas others really need to work on much more extensive kinds of difficulties that they may be having managing their child's distress. Taken together, this set of materials really provides a flexible framework for you as the clinician to work with your child and personalize to the needs of the clients and families that you are working with.